This is the dynamic cardiology. Using the AHA guidelines, you will work through algorithms for 4 separate arrhythmias. You will be team leader and voice your interpretation of each arrhythmia, also as well as all the basic, advanced, and pharmacological interventions you wish to administer. You'll be using the defibrillator mannequin you see before you and the ECG monitor defibrillator. Do you have any questions on these equipment?
I do not.
Okay. You put the pads on. If they don't stick, they fall. Leave them there.
All right.
You must verbalize everything you do, but all electrical interventions necessary throughout the skill will have to be physically demonstrated and actually performed.
Yes, sir.
You'll have 8 minutes to complete this skill once we begin and I give you the scenario. You may ask questions for clarification, and I will acknowledge your verbal treatments you indicate that are necessary. So, you respond to a call and find a patient who is a 55-year-old female complaining of crushing chest pain.
Okay, I'm gonna have my BSI on. Is my scene safe?
Your scene safe.
Okay, I'm gonna go up to my patient. Is my patient aware of my presence?
Yes, she sees you walking up. She can talk to you. Your eyes are open.
Okay, I'm gonna check her responsiveness.
She's alert and oriented times 4.
Okay, airway open, patent.
She's talking to you with no obvious signs of distress.
Okay.
For respiratory.
And she says she have crushing chest pain.
Crushing chest pain, clustering the chest.
I'm gonna go ahead and get a set of vital signs on my patient.
Blood pressure is 110 systolic. She has a respiration rate of 20. She's setting 94% on room air. She has a pulse of 120.
Okay, any history of cardiac issues or anything like that?
She has high blood pressure, she says.
Okay, I'm going to go ahead and have my partner hook up my patient to a 12 lead while I ask my patient to see if she's allergic to any medications or anything like that.
Patient says she's not sure if she's allergic to anything, but she doesn't believe so.
Okay, so I'm going to go ahead and I'm going to give her 4 baby aspirins orally, 81 milligrams for each tablet. I'm going to have her chew those up. And then I'm going to go ahead and give her 1 tablet of nitro sublingually, 0.4 milligrams. And I'm going to go ahead and turn on my monitor, check out your 12 lead there. So it looks like she's in sinus with bigeminy. I gave her the nitro. How's she feeling after the nitro?
Right as soon as you asked her that question, she became real pale and fell to the ground.
Okay, is my patient responsive or anything like that?
She is unresponsive.
Okay, is my patient breathing?
She is not breathing.
Yeah, I'm gonna go ahead and have my partner start CPR. I'm gonna have my partner get an airway. I'm gonna have my partner stop CPR and check for a pulse.
You do not have a pulse.
Okay, my partner's gonna continue CPR while I grab my patches. Put the patches on my patient. Looks like I have VTAC without a pulse on my on the monitor there. I'm gonna go ahead and shock my patient. I'm gonna select my energy level to 200 joules, and I'm gonna charge my patient while CPR is still going there. Okay, I'm gonna make sure everyone's clear of my patient.
Everyone is clear.
I'm gonna shock my patient.
We're probably gonna have to go in about 5 minutes.
All right.
Okay, shock delivered. I'm gonna continue CPR. I'm gonna get IVIO access.
Consider it done.
I have an advanced airway. I'm gonna give 1 milligram epinephrine.
All right.
And I'm gonna do 2 minutes of CPR.
Okay, your 2 minutes CPR are up.
Okay, I'm gonna reassess my patient. Is this the rhythm that I see on the monitor?
It is.
Okay, looks like VFib on the monitor. I'm gonna go ahead and charge my monitor again to 200 joules. I'm gonna defibrillate my patient. I have CPR going on at this time. Okay, I'm gonna make sure everyone's clear of my patient.
Everyone's clear.
And we're gonna shock my patient. Okay, I'm shocking my patient. I'm gonna continue CPR. I'm going to give 300 milligrams of amiodarone.
Okay, consider it done.
And I'm gonna do 2 minutes of CPR.
All right. Yeah, 2 minutes CPR cut.
Okay. Then I'm gonna reassess my rhythm. Is this the rhythm that I see on the monitor here?
It looks like it.
Okay. That looks like asystole on the monitor there. I'm gonna continue CPR on my patient. I'm gonna consider H's and T's.
All right.
I'm gonna give 1 milligram epinephrine every 3 to 5 minutes. And my H's and T's stand for hyperkalemia, hydrogen ion acidosis, hypoglycemia, hypothermia, hypovolemia, and the T stands for toxins, tamponades, thrombosis, trauma, and rapid transport of my patient. 1 milligram epinephrine every 3 to 5 minutes. Reassess my patient every 5 minutes, and emergent transport to the hospital.